Anxiety is more linked with worrying or finding it difficult to control our worries. They know something is wrong. They're not feeling themselves. And they often say, this is not me. Self-criticism can also be unhelpful, can actually maintain the problems for us. If a mother had a stressful pregnancy, maybe that already could impact us in some way. Without feeling low, we probably wouldn't know how nice it feels to be happy. It's just crazy how powerful our thoughts are. If you were to think of mental health physically, you can imagine it would be like people would be covered in bruises.
Welcome to a new episode of One Woman Show. My special guest today is Paula, a psychologist who focuses on cognitive behavioral therapy, so there will be plenty of interesting information on this episode today. And before we dive deeper into this topic, please don't forget to subscribe to my channel so I can create more interviews like this on exciting topics and with inspiring women. Welcome to One Woman Show, Paula.
Hello, welcome.
Hi, how are you today?
Yeah, I'm good, thank you. I hope you're okay and everyone listening is okay as well. And obviously we'll find it interesting what we'll be talking about today.
Yeah, I think it will be really very interesting because I haven't had a psychologist here, and I know that there is a lot of things that we could cover with psychologists, but I think that today we will be more focusing on the topic that is, I think, very common now for many people. And I think that it's very important to talk about it, because the more we talk about depression and anxiety, the more people know how to treat it, and the more they know that it's okay and there are solutions how to treat it. So tell me a little bit at first about yourself. Tell me how you got into psychology so we can get your background a little bit.
Sure. Thank you. So I first went to study psychology many years ago now, probably about 10 years ago, my undergrad degree. At my second year, I actually realized that I really like psychotherapy. So I changed into psychology with counseling skills. So there's just little differences between psychology and psychotherapy. So psychology, it's more about research. So you have, a lot of research into, various topic on psychology, mental health. And then psychotherapy, it's more to do with providing therapies to support people. So there's just that little difference. And I think as much as I love research and reading about research, I knew that I want to support people and help people, can manage their mood and their mental health. So then I did that. I became psychological well-being practitioner in NHS, which is another kind of role in mental health. And then did my degree in cognitive behavioural psychotherapy, so it was a very long journey to where I am now, probably.
And why did you decide to focus on cognitive behavioral therapy?
Cognitive behavioral therapy is one of types of psychotherapies, and it's a very unusual one, I would say, because it's very different to what people normally think when they think about psychotherapy. So you might imagine from movies, for example, where you lay on the couch or you just kind of talk about your problems, but CBT is much more practical. So it's much more about managing mood, learning different techniques and coping strategies as well. And it's very heavily based on research as well. It's probably the most researched type of therapy that obviously has been found to be very effective. So that's one of the reasons I think it's quite an interesting one.
When I was actually preparing for this interview, it was really very interesting because not not intentionally, but I was listening to a podcast, and over there they mentioned something about, there was a psychologist and he mentioned something about cognitive behavioral therapy. And then I was reading a book from psychologist and she was also mentioning some tools from CBT, and I was like, this is everywhere. This is amazing. So you decided to focus on this CBT, and what exactly it is?
Cognitive behavioral therapy focuses on your cognitions, so your thoughts, the way you think. So you might have different patterns of thinking that usually develop throughout your life. Some of them might have developed when you were a child, when you were younger, when you were a teenager. So that's usually the time where we learn about the world, learn about ourselves, about people around us, and we develop these different ways of thinking, or sometimes we call them our core beliefs, so what we believe in as well. Then from there, we also develop how we cope with things, and this might be, based on what we see around us, what maybe our parents are doing, or caretakers, and we learn as different ways of coping with things. And I guess if we think about from therapy perspective, the way we cope with our emotions as well, that's where we learn. So for example, even like small things like if we are children and we, run and we fall and we start crying because we hurt, but we didn't actually hurt ourselves, but we crying because maybe we were in shock or maybe there is some pain. And let's say we have a parent who comes to us and disregards our distress, just says, get on with it, which probably is very common and used to be as well. Even with small things like that, we can learn to dismiss our emotions. For example, is like a message to us that what we're feeling is not important. So then we kind of develop those different ways of coping with emotions or not coping, dismissing, for example. So that's a very long answer to your question, but basically in CBT we'll be trying to recognize those different patterns, different ways of thinking or doing things, and trying to either change it or challenge it. That's the kind of main concept, I guess, of it.
So when you do this therapy, you go in the past. Can we say that? Or that like basically based on how you behaved in the past, that's causing how you behave currently?
It's not necessary. We don't always have to go into past. Sometimes we do at the maybe like initial sessions when we, trying to understand where the problem might be coming from. So for example, if someone on this example I mentioned dismisses their emotions, we might look into like why or when did that develop, but we don't have to. We can work with what we have as well and just discuss if the way we may be dealing with things is helpful or unhelpful, or if there's any other way of dealing with it or thinking about it. So we sometimes do at the beginning in CBT, but CBT is mainly about here and now, the present moment, what's happening for us and how can we manage it better.
Okay, so I understand now that how it works. And so basically, if someone, because today we will be mainly talking about depression and anxiety, if someone has depression and anxiety and they come to you, what they usually experience? What feelings?
Yeah, so I guess we would usually use something called DSM-5 which is diagnostic manual for mental health disorders. And by that we say that if people experience different symptoms of depression or anxiety for more than 2 weeks, that means it might be helpful to treat it or to support them in managing those symptoms. So for depression, it might be symptoms like obviously feeling low, maybe hopeless, people often will have lack of energy, lack of motivation, maybe not enjoying doing things like they used to, so find it very hard to do things. For some people, even basic things like getting out of bed or going to work or even brushing their teeth, for some. And that will obviously have a big impact on their day-to-day life. Whereas anxiety is more linked with worrying, finding it difficult to control our worries, worrying about different things. So some people might even say that they worrying about worrying as well, which can be quite common. They will feel quite restless, probably, maybe irritable. Concentration might be impacted, for some even memory. So often I will see people when the symptoms just became maybe like moderate or quite severe, to the point that they're really impacting their day-to-day life.
So they feel that basically there is something not, they don't feel like they felt before, and they notice that something changed, and now they came to you because they are seeking for help, right?
Yeah, exactly.
So when they come to you, because I would like to like imagine someone who come to your therapy, you know, because like if there is someone who listening at the moment, then they will find themselves, you know, in these situations. They will know how it works basically and what they could expect. So when someone will come to you, do they say straight away, oh, I have depression, I suffer from anxiety, or they will tell you all those factors like I feel very low on the mood, I don't enjoy my work anymore, I don't know what's wrong? Is it like this?
Yeah, usually people might not always know what's wrong, but like you said, they know something is wrong. They're not feeling themselves, and they often say, "This is not me," or "This is not how I used to be," or "how I behave." Obviously, some people have been struggling from depression and anxiety for many years, and they would know what it is. Maybe they were diagnosed in the past, but for those who suddenly started feeling worse or not themselves, they will often come and say, I'm actually not sure what's wrong. But I will ask them, I will assess what might be wrong. We'll go through the questionnaires together. We'll talk about the symptoms that they're experiencing, what's different, what's impacting them, especially what's maintaining those problems. This is what we would be really interested in. And then again, going back to CBT idea, are there any patterns of thinking? So it will be any negative thinking maybe. People would have different self-critical thoughts or kind of should statements, so different kind of thinking biases, we call them sometimes, or thinking errors that actually maintaining some of the difficult emotions. Or maybe is there something they do or avoid that maintains their problems as well. So we'll be obviously looking into that, assessing that with them, and especially interested how it's impacting their day-to-day life.
When I was reading that book with one psychologist, she said that during the therapy that you ask questions, and would basically help to, and correct me if I'm wrong because I can be wrong, I was just reading about it, that you try to help the client to look at the situation that he or she goes through from bird's eye view. So they are not like in their own hurricane or tornado, So someone actually else tell them how it looks from outside world.
Yeah, exactly. Because we're quite often really good at, advising others, or if there's a friend or someone we know that has a problem, we know exactly what to say and how to say it, and we're compassionate in the way we say it to them as well. We're very caring, but we often don't do it for ourselves. So even the way we talk to ourselves can be like more rude or critical. We might be saying things to ourselves like, why you're not doing this, get over yourself, you should be able to do this, so that, which we would never use those words to someone else. And then that kind of self-criticism can also be unhelpful, can actually maintain the problems for us quite often. So actually stepping back and even thinking, what would I say to a friend in this situation? Or, yeah, if I was a fly on the wall, how would I see this situation? Because especially with the thoughts, they can often be very negative. And, you know, we see things in a very kind of, with like gloomy specs. The negative thoughts can sometimes look at one kind of situation only. They don't look at the whole picture, the whole situation. So we'll be looking at alternative way of thinking as well.
And many times I think that I'm speaking from my own experiences. Many times it's really very helpful to just go out for a walk, or basically go out from the place where you are, and even that can help to look at things from different perspective, because you are not in that environment where everything was happening. You know, like many times we say, oh, I need just to get some fresh air, you know, and that can help a lot.
Yeah, getting some perspective, getting out of our heads. And there's lots of different ways of doing that. So going for a walk, or even changing the room you're in and going to another room, going make ourselves a cup of tea or coffee, and clear the mind. It can be very helpful, definitely.
Are there any best strategies to help to manage anxiety? Because we were already, or depression, or these feelings when we feel really very low on the mood. I know that we were already talking about a couple of them. Are there any more?
And I think it's worth saying as well that the symptoms of depression and anxiety can often overlap, or they might be kind of linked, or they might be affecting each other. So for some people, it might be that they're feeling very anxious, and anxiety itself can be very draining, very tiring, or the worrying, and that can actually impact the sleep. And then if the sleep is impacted, then we feel more tired, and then the tiredness has very similar symptoms to low mood, that kind of lack of energy. So that anxiety can impact depression, and the same other way around. When we feel low, we might be doing less, we might start worrying more because of that. So they can also impact each other. So sometimes we have like different techniques for depression, different techniques for anxiety, but they can also impact each other positively. So with the anxiety, so definitely diffusing from those worries in some way. So like we talked about, like going for a walk, maybe shifting our attention onto something that might be more helpful for us. So with worry, obviously, it might be things like meditation, mindfulness, doing something relaxing, or an exercise. So the kind of, we call it passive relaxation, which is the kind of soothing meditations, or having a nice bath, or lighting a candle. And then active relaxation, which is exercise, any kind of jogging, walking, swimming, whatever we like, dancing, to release some of that anxiety. We'll also want to look at managing our worries, especially with anxiety. So usually the easiest way to think about it is to reflect on what might be within our control when we worry about something, and what's outside our control. So again, reflecting and really looking at what is worrying us, what are we thinking exactly, what's the worst that could happen. So again, in therapy, I think we're really analyzing like a lot of that, which, correct me if I'm wrong, but I think many people don't really do that too much. We quite often on this autopilot, we go through life and we're trying our best. We don't always kind of stop and think, how am I feeling? What am I thinking? What am I doing?
Yeah, I absolutely agree with you, because this is exactly like what I started doing like every single evening, and I was kind of like at the beginning like forcing myself to write my diary every single evening, to put the thoughts on my paper. And I have like no shame to admit that I was suffering from anxiety, you know, and now and then it still comes. But and but something what I really want to like ask you, because you are a psychologist, and maybe people, maybe you can correct me if it's not right what I was thinking, that, and once again I was just speaking from my own experiences, that all of those stuff like meditation or box breathing or writing diary, writing gratitude, go for a walk, go for a run, for me personally it was only like
On
kind of
like a
like on,
surface level,
yes,
like
exactly,
just
like keeping,
maintaining it.
yeah, exactly,
Yeah.
like it helped me just for a few minutes, you know, when, but it did not solve my anxiety. It didn't help with the cause of the
Yeah.
anxiety. Am I right? So
Yeah.
that you have to go like deeper into why it's happening, and maybe then it will be kind of like fixed, you know?
Yeah, so it really depends on the person usually. Some people do need it. Maybe they need to look into the core of the problem, what happened, and counseling. So the kind of your typical talking therapy can be quite helpful for that. So, just having that space to reflect on the life that we have or we had, and maybe looking into what might be causing the problems as well, having that kind of safe space to talk to someone about our life, our past life. Or others just need some kind of management, worry management, anxiety management, to manage more kind of here and now. So it really depends. And I quite like there's a stress bucket metaphor for this, if you don't mind me saying that.
Yeah, of course.
So I really like this metaphor of a stress bucket. And if we think about a bucket being our life, and then on the bottom of the bucket, we have our kind of nature versus nurture. So what we're born into, really. So even thinking about our genetics, some people might be more prone for anxiety or depression, our nurture as well. So like, for example, let's say if a mother had a stressful pregnancy, maybe that already could impact us in some way, what was happening when we were very little. Then we have childhood experiences. So if anything maybe very stressful happened when we were children, it can be like parents divorcing, changing school, maybe being bullied, anything that had maybe a kind of difficult impact on us, that already could impacted our like mental health. We also, like I mentioned before, we learn from what we see. So if, let's say, our parents are quite anxious people and we see them worrying, we see them telling us be careful all the time, or kind of seeing worst case scenarios, we can already pick up those behaviors. And some people, which is interesting, some people say that it feels like it's their personality, like I'm a worrier, I worry, but we think about it more as a behavior, something that we do, meaning it can be changed as well, a behavior that we can pick up from parents even. And then coming back to stress bucket, then we might have like major life events. So this doesn't have to be anything negative, but maybe very stressful. So it might be our first job, moving away from our parents into our first house, traveling countries. It can be marriages, having a first child. So these big life events that can be happy but can be extremely stressful at the same time. And then on top of that, it's not finished yet, we have more kind of traumatic life events that come into that bucket. So it can be any bereavements, any life changes that maybe were quite difficult, divorce, being in an accident, or even loved one being in an accident. So they're very stressful kind of life events. So obviously we're not superhuman, none of us, and that's why none of us is, we can't say that we'll never have any mental health difficulties, because we all have a limit. And quite often, even in my practice, when I see people, it's usually that the bucket is just too full. Maybe too many things happen and they were just about kind of managing, but this one big thing, or even small thing, for some people it can be a small thing, came in the bucket and just completely tip everything over the edge. And that's how you feel that, okay, something is not right here. And if you imagine the bucket, imagine like a tap on the top of the bucket as well, with little like water dripping in. That's everyday stressors. We sitting in traffic, having to call a doctor, having to pick up child from school, having to go to work that we don't like all these little stressors coming in. So there's just so many things that we have in life in general every day, and obviously from time to time maybe something more stressful happens. So what you were saying about in terms of meditation, exercise, the way we look at it in CBT is like we poking holes in this bucket, the little holes to let the water flow. So this exercise to release some of that stress, meditation for the mind to have a break for the 5 minutes in a day from the worries, for the body to feel better, maybe more relaxed. So all those things are very important for our mental health, the self-care activities. But yeah, they might not solve the problems, or they might not solve what's in the bucket, but still very important.
That was exactly what I wanted to ask you when you were talking about the bucket can be full, that how it was the question in my mind, that how we can empty the bucket regularly, and that actually makes sense, to take just, for me, it's really very relaxing to, when I'm working all day, just like set up timer for 10 minutes and go watch some movie or video, it's like completely take me out of thinking about anything, because I'm fully focused on that movie, or funny video. And this is exactly like that will empty my bucket for for a little while. And yeah, so now it makes actually sense what you were doing. So thank you very much for that. And people will know. And so basically when people will come to you and you will give them these tools to handle depression, anxiety, is it possible to get rid of it completely?
No. Completely no, because it's a part of us, a part of being human, to be stressed, to be anxious. It's actually very important that we do have those feelings. So, as much as without depression or without feeling low, we probably wouldn't know how nice it feels to be happy. Or without anxiety, we wouldn't know how it feels to be fully relaxed and without worries. So, and we need all the emotions, really, we need them. It's obviously all kind of comes from our survival and the kind of old brain that we have. So all the emotions have different purpose. So anxiety especially, very kind of survival emotion that's still needed. And worries, for example, can help us to problem solve sometimes. So in that sense, we're not going to get rid of them. We probably don't want to get rid of them. But maybe sometimes we want to manage them better. Maybe they just becoming too overwhelming. Reduce them maybe, or reduce the intensity of it.
How long does it take to treat or get rid of or disappear a little bit?
Yeah, so in terms of CBT, and CBT is especially recommended for anxiety because it's so practical. Quite often just talking about our worries, it might not help as much. So actually having practical skills and strategies can be more helpful, and it's actually more recommended. So CBT is also a very short-term type of therapy. So it's not a therapy like counseling that you can be on for a year or as long as you want, really. You can have that space to come and, reflect on what happened or what's happening. CBT is more short term, so to give you a number, it will be anything from kind of 8 to 14 sessions approximately to see progress really in people, and then to prepare people, to basically give them these different tools and strategies so they can become their own therapists in a way. So that's always our goal in CBT, for people to feel empowered that they can manage their mood without a therapist or without having to depend on someone else. So in that sense, it's a very short-term type of therapy. And of course, it depends on the person. Some people, probably depression or some disorders, might need more, might need 20 or 24 sessions. Some people have like 10, then have a little break to practice techniques, then come back. So it can also depend. And just wanted to mention as well that anxiety also is like an umbrella term. So when we think about anxiety, we'll have different types of anxieties as well. So some people might struggle with specifically health anxiety. So they would really worry about their health and getting some kind of lifelong illness or life-threatening illness. Some people might have social anxiety, so it's specifically to do with anxiety around social situations. OCD, so obsessive compulsive disorder, would go under anxiety, or generalized anxiety. So that's where we would worry, find it very difficult to control worries. So there's lots of different types of anxieties as well that we would treat with CBT.
Based on which anxiety it is, then you give that patient or client the treatment, right?
Mm-hmm. There would be different techniques, yeah.
We were talking about why anxiety and depression can basically start, if we are worrying about something. Mm-hmm. And I have one question that I wanted to ask you, and that's about the weather. Because I live in Ireland, you live in England, and we know what it is to have rainy days for 10 days in a row. And I never actually realized, because I was living in Slovakia for 25 years, and I never actually realized how important it is to have sunny weather, or at least sunny weather, or not rainy weather, that how much it can affect mood. And this is something what I would like to ask you, that how much it can actually affect our mood.
A lot. Yeah, definitely. And why is that? I guess is there's so many different factors to it. So obviously when it's not sunny, then we naturally feel like less motivated to go out and do things. And actually what we know about activities is that activities are very much linked to our mood. So when we do something, we feel better. When we do less, we feel worse. So there's a huge link between that. So let's say if you imagine someone coming up to you and tell you all the things that they've done over a weekend, they don't have to tell you how they're feeling, but you will get a sense of how they're feeling, if they're happy or they're sad, based on activities. So in that sense, activities are huge when it comes to our mental health and our mood. So obviously when it's dark, when it's raining, we have less opportunities, I guess, to go out, enjoy ourselves, do something fun after work. So sometimes we need to force it. So we need to force ourselves to actually still do things after work. Obviously not going to be in the sun or a nice weather, but going for that walk, just wrapping up, for example, or having something planned for the evening that's nice, kind of doing something indoors. So that's one side of things. Then quite often people get a seasonal depression as well. It might be very physical. So it might be a lack of vitamin D, which apparently, especially in those countries like England, Ireland, majority of people have kind of deficiency in vitamin D. And that itself can cause us feeling more fatigue. Some people might even feel like muscle aches, and they will be then less likely to obviously do things as well, and that can impact the mood. Actually, I was thinking about this, I think 2 or 3 weeks ago. I was like this close to go to kind of suntan play or I don't know what's it called, sunbed, because I felt like I was craving vitamin D, like I was craving the sun. I do take supplements for vitamin D, but I felt like I really need like a dose of sun, like physically I felt that. I didn't go at the end because it was, I think next day it was really sunny, and I just went and like just put my face in in the sun. But yeah, it's so important as well. Or yeah, we can go around it by maybe like booking holidays in winter, making sure we get that. There's, I think, special lamps. I never used it, but I've heard about like this special lamps that you can just have on your desk, and apparently they can help to produce vitamin D as well.
This is something what I wanted to actually ask, because on your blog I read about how weather can impact our mood and mental health. And over there, one of the recommendations that you wrote down was with that light therapy. And I was like, this is actually, I never thought about that. And that's something what next winter, like this winter that will be in December, I will definitely try it. I will buy it. I will try it, because like those dark evenings, I had enough of them, and like, so that's something what I definitely want to try, and I will see how effect it will have on me, because I never tried that.
Definitely. Yeah, I've always been thinking about buying the lamp, and yeah, I always forget to do that and try it for myself as well. Yeah.
I will let you know. I will let you know how it was. Yeah, so we basically covered what is anxiety and depression, how it can start, and how it can basically be treated during the therapy. And you also said that it's very important to talk to psychologists or counselor about how we feel, that sometimes only talking about things can really help, And we were also talking about some tools, how to manage anxiety or depression, about that bucket that, can help us to release some stress a little bit. And it is actually very, very important to go sometimes deeper into why it's happening, so we can get rid of it, maybe not like forever, but at least for some times. And my last question would be maybe how we can like talk to ourselves that we wouldn't put ourselves in a really bad mood, because sometimes we can be really very harsh on ourselves. And you said that things that we wouldn't say to our friend, we shouldn't be saying to ourselves. So what should we say to ourselves?
I think first thing to really notice is to pay attention and even monitor, like write it down somewhere whenever we notice being harsh on ourselves, or when we notice any kind of self-critical thoughts, or those kind of should statements. The should statements are very common and very dangerous. So, when we say, I should be doing more of this, or I shouldn't be feeling like this, I should be more productive, I should work more, I should eat less. Like all these shoulds cause so much pressure, and when we feel pressured, we probably not gonna do well because then that kind of feeds into that kind of vicious cycle. Probably we'll feel guilty, then we're less likely to do well. So it's, in that sense, can be very unhelpful. And monitoring should statements or monitoring self-critical thoughts to start with can be very helpful, just to increase our awareness into the thoughts that we use, and from there we have more of a choice. Is this, we can analyze, is this a helpful way of thinking? Would I say that to a friend? Probably no. Is there other way of looking at it? Or can I maybe think of alternative way of thinking or talking to myself? So, instead of saying I should be doing more, I can, or it will be helpful for me. So changing the words that we use, which is so important. And actually, if we're thinking about the power of thinking, power of thoughts, there was this amazing research that I always remember, where they had two groups of people, and they measure how fast they run. And with one group, they gave them a list of slow words. So it would be things like, I don't know, slow, old, maybe, so anything that kind of is like a synonym to slow. And then the other group had fast words. So it might be youth, really fast, I don't know, jogging, like all these kind of words. And then they measured them running again. And what they found is that people with slow words were actually running slower. People with fast words were running faster than before. It's just crazy how powerful our thoughts are. And you might have heard of things like manifestations and affirmations. And I know a lot of people think it's like what is it? But it's actually work, There's so many things you can say to yourself, something, and then until you actually believe it. Or they say fake it till you make it kind of thing as well. It actually can work sometimes, because if we say it to ourselves many times unconsciously, you might kind of register, and we might start doing things that kind of align with those thoughts as well. So as much as negative thoughts can impact us negatively, obviously positive thoughts can also impact us positively. Yeah.
And I agree with those words, because saying yourself that I should do something, or I have to do something, or, like, you don't have to, like you can just like decide to lie on the bed all day, and that everything will wait, like nothing will happen. I mean, that we very often put on our shoulders like a lot of things that we are not able to carry, and then we are like, oh, I have to today, I have to wash the dishes today, I have to do my food today, I have to do laundry today. Actually, when I realized that, no, I don't have to, like that laundry will wait over there for me until tomorrow, then I realized that I can actually just relax and I don't have to feel stressed, and it's okay,
Exactly. And if your friend had a difficult day or stressful week, you wouldn't be telling them, why don't you do your laundry right now? You would tell them, just relax. You had a difficult week, and you would be compassionate to them as well. And that's another problem. Quite often we can lack that self-compassion. And this is often because we're not really taught self-compassion. Because if we're learning the word from what we see, as children especially, we're not really learning how people talk to themselves. We can't see it, we can't hear it. So we're often not taught to talk to ourselves with that kind of compassion. Or we taught, always take care of others and be there for others and support everyone, but not yourself. And that can be a problem sometimes. And it's good to realize all those things and really reflect on how helpful and unhelpful this is. So maybe we have a choice to change it.
Yeah, I do absolutely agree, because that's very important, how we talk to ourselves. Yeah, I think this was a really very fantastic session. Is there something what you would like to add, like what we maybe forgot to say?
I think we covered a lot of stuff, actually. there is so much, like we can talk and talk. I definitely recommend anyone to, seek support or reach out for help. I think we also thinking quite often about psychotherapy. What I see people waiting till that last end when the bucket is just so full, and like coming into therapy when they just like can't, like they don't even know what's their name, and maybe that prevention will be helpful. So if you're already noticing that it's kind of getting there, something is not right, seeking support, it will be easier for you and for the therapist as well, probably, to help you, rather than like like where do we even start, kind of thing. So yeah, definitely. And it can be very helpful, I think, to have someone completely not judgmental, someone who knows what they're talking about. Obviously they studied it for years, they supported many people, and it's the same as you think about, if you break your leg, you're not gonna be like, I'm gonna be fine, let me read a book of how to put my leg together. You'll go to a doctor, right? So it's the same with mental health. I like to think about it in that way. You would, seek support as well.
That's very true, because like people take care of their physical health because they can literally see if they have broken hand, or if they have not very good hair, or something, they take supplements, or they go to doctor to fix their leg or something. I feel that if they cannot see something, then it's not maybe on the top of the priority list, because it's somewhere in your mind. It's you cannot touch it, and people many times they might think that why would I go to therapist? Like what I will tell them about my life, and then what he will like he won't be able to get rid of my worries, because like I have to pay these and these, but it's not about therapy is giving you money to pay rent or something, but it's more about that you will give them a different perspective how to handle that situation, and or they might look at things differently, and that will help them to treat the situation. So no matter what thoughts and doubts they have, to go to therapies, I think it's always worth it.
Definitely. And they said if you were to think of mental health physically, you can imagine like it would be like people would be covered in bruises. That's how it would kind of look. But obviously we can't see it, which can be a challenge sometimes. And luckily, I think we on the right path of, kind of challenging that stigma and talking more about mental health, which is so important because we all have it.
So if someone would like to approach you and they feel like, wow, I would really like to talk to someone, and they are courage enough to speak to someone, where could they approach you?
So myself, obviously, I hope kind of share the Instagram. I got my Instagram page, which has a link to my website. There's also websites like Psychology Today, where you have a list of different psychotherapists. So I'm on there as well, but obviously people have their preferences, so they can always check other therapists. I offer remote therapy, which is usually on Zoom or some kind of platform. Obviously I specialize in CBT, but I do include other forms of therapy in my practice as well, like acceptance and commitment therapy, which can be quite helpful also for managing any health conditions. So when people are struggling with any long-term health conditions and adjusting to like a new way of living after being diagnosed, that kind of therapy can be quite helpful. Or mindfulness-based stress reduction, so that's another one, especially for anxiety and stress, that I love as well. So we'll kind of use different types. So I offer a 20-minute initial call where we can talk about, what might be the problem, what people are looking to kind of get out of therapy, so we can think together if this type of therapy it's a good kind of fit for a person, and then I can obviously advise on that as well. So people can book with me through the website, or they can email me. There's my phone number as well. They can contact me in different ways.
I saw actually that website, so I will put everything in the description box so people can contact you even on Instagram or your website or the other website that you mentioned. So I will put everything over there. And yeah, so I want to thank you for such an amazing episode of this podcast. And I think that we could, as you said, like we could talk about this forever, because there's like so much to cover and it can be such a deep conversation. So that I presume that that's for then everyone, you know, to seek the help and don't be afraid, because like those therapists, and they know what they are doing, and they are here for us to help us, you know.
Exactly.
So if there is someone who is doubting, I do definitely recommend just to go give it a try. Paula is offering 20 minutes initial call, so you can see if it's something for you or not. But I would say that it's 100% worth it, always.
Thank you.
So thank you very much, Paula. I think that next time we could cover a different topic. There is always a lot to talk about. So thank you very much for being my guest, and I'm looking forward to talk to you on the next episode.
Thank you. Take care.
Bye bye.